This video is for educational and entertainment use only. The views in this video do not necessarily represent the views or life of Marlon Dixon.
Welcome back to Duffle LO, to sit down, you guys. In the last video, I told you guys how the Supreme Court did another power grab. They did one all the way back in the day with the Madison versus Marbury case. Make sure you guys do your homework and read that. And if it's your first time coming to the channel, welcome. Like the video, share the video, subscribe to the channel, make sure you hit the bell. We're trying to beat that YouTube algorithm. Remember, we're trying to get our subscribers up to 1,000 before May. It's still January right now, but you might see this video in February. But let me share my screen so I can show you guys another power grab that's going on in another country. Look at that right there. What that say? What do that? What? Look at that. Look at that. Quebec to impose health contribution tax on those who refuse COVID vaccines for non-medical reasons. What's your reason for not getting that vaccine? I don't know what's in there. Do you know what's in there? That's why I ain't getting the vaccine. So that is a medical reason for me to not want my body to be messed up in the future. But people got to understand this. But let's get into it. This is January 12th, 3 days ago. Lee Cohen, shout out to her. Listen to this. Leaders, watch out, not now. We want to be the first to know, but y'all chill out on that right now. Leaders of Quebec, Canada are planning to impose a tax. This is a tax, ladies and gentlemen. So just how you got to pay state tax, federal tax, unemployment tax, you got Medicaid tax, all these taxes, but this is Canada. So this is not the US, so it doesn't apply to us yet. But I just want you to see the man of the power grabs during this. So Canada are planning to impose a tax on adults in the province who refuse to get vaccinated against COVID-19 for non-medical reasons. The tax, he said, is a consequence for unvaccinated people who put a very important burden on our healthcare network. Legault said the decision comes as the province continues to see an increase in hospitalizations. Now, mind you, everybody that's being hospitalized is not old, but a lot of people that are older are already unhealthy, already have underlying health issues, do not eat right, do not exercise, do not sleep right, is overworked, super stressed. This is why they're getting sick, because we already had this healthcare problem. Well, you guys understand, over here in the West, a lot of people are overly overweight and obese. They overworked, underpaid. So this this COVID situation was able to just come and just make people sick. But let's get this. If you look at what's happening in other countries or other states, everyone is trying to find a solution. He said, right now, these people, they put a very important burden on our healthcare network. And I think it's normal. The majority of the population is asking that there be a consequence. Quebec has been hit the hardest of Canada's provinces and territories, according to the nation's government. There have been nearly 93,000 officially reported cases in the province in the last 7 days, according to the government's database, and 247 deaths. Let's break down the numbers. If you look at 247, what's the first thing that come to mind? 24/7. That's every day, all day. That's what that is. Roughly 92% of people in Quebec ages 12 and older have received at least one dose of COVID vaccine, according to the province's health data. Vaccination, Legault said, is the key to fight the virus. Now let's break this down. Look what this is. If y'all already at 92%, y'all already should have reached herd immunity. So why are you trying to tax the small 8% and saying that they putting, what did he say? They're putting a burden on our healthcare network. How? If 92% of the people are vaccinated, how y'all got 93,000 people that's been in the hospital this week? That you have to understand the numbers. The numbers don't add up. Herd immunity starts at around 65, 70, 80%, somewhere around there, one of those numbers. So let's just say 70, between 70 and 80%, you reach herd immunity. Herd immunity is a medical term where a majority of the people in this community is vaccinated. So because so many of those people is vaccinated, is more likely that they won't have the virus, start spreading rapidly again, because most people is vaccinated against it. That's what herd immunity is. Do your research. But if 92% of their people is vaccinated, why is the other 8% putting a damper on the health care network? I don't understand it. This is why we're looking for a health care contribution for adults who refuse to be vaccinated for non-medical reasons. Those who refuse to receive their first dose in the coming weeks will have to pay a new health contribution. He said, I know the situation is tough, but we can get through this together. You making it even tougher. If you already know that it's tough, why is you making it tougher by making these people pay even more when in reality it's the people that already got the first dosage that's still getting sick? So the people that's unvaccinated ain't the ones that's getting them sick, or are they theorizing that? The amount of the tax has not been decided yet. Legault said in a Facebook post explaining the decision, but it will be a significant amount. Look at that. So now you go on to Facebook and you're telling these people, yeah, we're going to get ready to tax you real significant. What significant is means 10,000, 5,000, 400, 300, depending on the person. Because a significant amount to somebody that has zero is $100. A significant amount to somebody that has $100,000 is $60,000. So what do you mean a significant amount? The tax is just the latest measure put in place to try to curb the spread of the virus in Quebec. The province has also mandated remote work for any position that will allow it, cancel sports and extracurricular activities in schools, close secondary schools, limited store and restaurant capacities, and limit private gatherings, among other things. There is also a curfew in place from 10 p.m. to 5 a.m. You got to be in the house at 10. You telling me I'm 33 years old and I got to be in the house at 10 o'clock on Friday and Saturday? The club don't start popping the 10. Drinks don't start flowing the 10. Girls ain't coming out and trying to look cute till 10:30. They've been getting dressed at 7. And I already got to be in the house at 10. I know they messing with a lot of businesses over there. Quebec also has a vaccine passport system that allows those aged 13 and up who are adequately protected against COVID to access certain places for non-essential activities. But Legault said we have to go further. Adequately protected? Why would you quote adequately protected? Wouldn't that just mean they got the vaccine? Wouldn't that's all that mean? But what you mean you have to go further? This is why I watch these videos and we're gonna see how far they really trying to go. Just watch. Right now, it's a question all about fairness for the 90% of the population who made some sacrifices, he said. I think we owe them this kind of measure. So we tricked the 90%. Now we're trying to get the other 10%. Legault tweeted in French that unvaccinated those represent 10% of the population, but half of the COVID hospitalizations in intensive care. Okay, so this little 10% account for half of the hospitalizations in intensive care. So you telling me that the entire 10% is in intensive care. So if they're in intensive care means you almost, you days, weeks, depending on your immune system, from checking. So the healthcare system already is strained because the workers are being overworked and they're having burnout. Some people don't want to get the vaccine, so then they're forced to quit their jobs. So it's not staffed adequately. That's why it's being strained. Like, so it's not just the 10%. You worry about the 10%? No. Like, y'all got to really be understanding this stuff. The announcement came a day after the province's health director, Dr. Horacio Arruda, resigned from his position, which he held for more than a decade, according to the Canadian Broadcast Corporation. Arruda stepped down in the wake of increased criticism over officials' pandemic response. Notice a lot of these CEOs and these people resigning. A lot going on. Arruda's criticized for supporting indoor gatherings of up to 20 people through the holiday season, according to CBC, and for not providing evidence for the benefits of the new overnight curfew. See, that's why he had to resign, because you did something and then this happened. So now you got to go. You guys should go. Days before his departure, the province announced that PCR testing hit such a high demand that the Ministry of Health and Social Services halted PCR testing for the general public. As of January 4th, tests have been prioritized for those deemed most at risk of infection. That's them healthcare workers, including those in hospitals and other healthcare facilities, those in detention centers, children, and people in First Nations and Inuit communities. Those who are symptomatic but don't get priority are permitted to use rapid tests available in pharmacies and have been urged to isolate. Legault said Tuesday that despite the criticism, he stands by Arruda's guidance throughout the pandemic. The recommendation he made with the information he had when he made those recommendations, I think that it was coming from after consulting other experts, like I said, there are some advantages to somebody new after 22 months because it's a very heavy burden to have. They getting ready to significantly tax people over there. It's all a money grab. Because think about this. With you closing all these restaurants, closing all these businesses, and they not open for those times they normally be open where they mainly make their money, nobody's out spending money. When nobody's out spending money, the economy goes down. When the economy goes down, everything starts to get frustrated. Everything gets frustrated. People get frustrated. Kids get frustrated. And then people just start doing stuff. They start losing their mind. They know how to act. Imposing a tax on people because they don't. I refuse to put something that I don't know what's in there in my body, and I gotta pay because I'm worried about my health. But you telling me that you worried about everybody else's health, that's why I gotta get it. Did they know what was in there? No, they ain't know what was in there, but they still got it, right? So they voluntarily did that, you know. But because I'm worried about my health and I don't want to get it, I gotta significantly pay a tax because what? That don't even sound right. It does not sound right. It might sound right to some people that's scared and they in fear and all that stuff. It totally sound right to you. But when you logically slow down and think about it, 90% is vaccinated. They already at herd immunity. 10% is not. They're blaming the struggle in the healthcare system on this 10%, not on the 90%. Even though 50% of the people that's in intensive care is vaccinated. So now it's strange that you vaccinated, I'm not vaccinated, but we both end up in the same place. So what's the point of me getting the vaccination if it's a 50% chance of me ending up in intensive care next to you? Like, you have to understand statistics. You have to understand these numbers. You have to understand these words because they're telling you everything that you really need to know. You just need to understand what they're saying. It don't make no sense. So they shouldn't be taxing these people because these people don't want to get vaccinated. Like, bro, if it's religious exemptions, if it's healthcare exemptions, okay, I'm exempt, bro. I don't know what's in there, so that's why I don't want to get it. That's it. Point blank. Period. Y'all ain't did enough testing for it. Y'all ain't tested the pigs. Y'all ain't tested the goats. Y'all ain't tested the sheep. Y'all ain't tested the goddamn cows. Y'all ain't testing none of that. So since y'all ain't testing that, now I don't see no research that I done read about it because y'all ain't had long enough time to test all that to understand what's going on. Why would I put that in my body? But now I got to pay because I won't put something in my body, although I'm worried for my health. But you saying I should be worried for everybody else. So that means I should always worry about everybody else besides myself. That's all I got to say for this video. Hopefully you guys learned something. Hopefully you guys found something interesting. Hope you guys look into this stuff. Like, be honest with you, it's a lot of stuff going on. And what do you think about the tax? Do you think it's cool? Do you think it's not cool? Are you from Canada? Did you get vaccinated? Did you get vaccinated? Do you think they should pay the tax? If you didn't get vaccinated and you're in Canada, how much? What's the significant amount? Put it down below. Like, I want to follow the story and know what's going on with a follow-up. So, like I said, man, you guys prosper through adversity. Don't underestimate family, friends, lovers, enemies. Look objectively. No matter what city, state, or country is in, every hood is the same. And if nobody told you that they love you today, I'm going to tell you guys that right now because I truly love you. That's why I bring you guys this information for you guys to become aware of what's going on so you can make reasonable decisions. You have to get the logic, the reason, and the critical thinking skills now to understand what decisions you need to make for your future, for you and your family's future. So shout out to those in Canada that got the vaccine. Shout out to those in Canada that didn't get the vaccine. Hopefully, wish health and prosperity to those that's in intensive care. Hopefully you guys make it out and we get over this pandemic and we see what happened. But that's all I got to say for this video.
This video is for educational and entertainment use only. The views in this video do not necessarily represent the views or life of Marlon Dixon.